Electrocardiogram, it's the means by which the electrical potential generated by the cardiac cells during cardiac cycle can be graphically recorded by using an electrocardiography machine. يعني هو تسجيل النشاط الكهربائي لعضلة القلب. The purposes to do the electrocardiogram. ECG is used to measure the rate and the regularity of the heartbeat, عدد دقات القلب, and to indicate if the rhythm of the heart beating is regular or not, that the heart has a regular rhythm or irregular rhythm. The presence of any damage to the heart, هل حدث هناك أي damage لعضلة القلب, that may occur among patients with acute MI, and this damage could be represented in the ECG as specific changes that may indicate the damage. The effect of drugs or devices used to regulate the heart such as pacemaker. إذن تأثير بعض الأدوية أو زراعة منظم لكهربائية القلب. تأثير هذه الأشياء على كهربائية القلب could be detected by ECG. The ECG can be performed bedside, patient supine position. We have to have a good electrode placement and the patient remain still during recording, which means that the patient should be constant, ثابت, مستقر, no movement, and remove any metallic material during recording the ECG. 12 lead ECG used to provide a 12 views of the heart, 10 leads attached to the patient, and this 10 leads that attached to the patient may or provide us with the 12 views for the heart. These 10 leads presented on the chest and on the limbs, right hand, left hand, right leg, left leg, 4 limb leads, in addition to the 6 chest leads equal 10 chest leads. These chest 10 leads provide us with 12 views. We have to remember that where the positive lead is, it's like camera and provide a view of the heart from that perspective. The 12 lead ECG, 3 standard leads, 3 augmented leads, and 6 chest leads. The standard limb leads, also called bipolar limb leads, composed of electrodes, positive and negative electrode, and the ECG records the difference in electrical potential between them. تسجيل الفرق في التيار الكهربائي ما بين القطب الموجب والسالب. There are 3 standard limb lead أو 3 bipolar limb leads, which are lead 1, 2, and 3. Lead 1 recording the electrical activity between the right arms, negative, and the left arm, positive, and used to obtain a rhythm strip. It also provides us with the left lateral view of the heart. Lead 2 recording the electrical activity between the right arm, negative, and the left leg, positive. Lead 3 recording the electrical activity between the left arm, negative, and left leg, positive. Both lead 2 and lead 3 provide us with the inferior view of the heart. This picture clarified the standard limb leads, which is right arm RA, negative, LA left arm, positive, Left leg LL at the inferior of the triangle, positive. When we are recording the electrical activity between right arm and left arm, we can give the lead 1. When we are recording the electrical activity between right arm and left leg, between negative and positive, lead 2. And when we are recording the electrical activity between left arm and left leg, between negative and positive, lead 3. This picture clarifies where we can put the electrodes to obtain this triangle. Right arm on the third intercostal space, left arm here, and left leg in this place, mainly at 9th or 10th intercostal space. The augmented limb lead is the unipolar أحادية الأقطاب, which means that it's recording the electrical activity from only a single positive side. Recording electrical activity at that point with reference to the other remaining leads. إذن هي تسجل النشاط الكهربائي بالنسبة للنقطتين المتبقيات. The voltage in these leads are extremely low. The voltage in these leads are extremely low and must be augmented to equal the voltage of the remainder of the ECG. طبعا الماشين اللي هي جهاز ال ECG هو اللي بيعمل هذا الشيء، عشان هيك سميناهم augmented limb lead. عادة الفولتية بتكون فيها قليلة. The electrode either on left arm, right arm and left leg. These are limb leads provide view from vertical plane، يعني سطح vertical عمودي. The augmented limb leads or the unipolar, there are 3: AVR, AVF, AVL. AVR, which is augmented voltage for the right arm. The right arm is positive electrode in reference to the left arm and left leg. As we said previously, it's recording the electrical voltage of the heart from a single positive side in reference to the other 2 points. It records the electrical activity from the direction of the right arm, away from the direction of the right